Welcome to the Explainer. Today, we're tackling one of the most intense, high-stakes situations you can ever encounter in animal rescue. We're getting right into a life-saving volunteer training protocol that's designed to equip you with the exact knowledge you need when every single second counts. I want you to imagine you're fostering a tiny newborn neonate. Everything seems perfectly fine, and then, suddenly, it's not. What do you do when a kitten crashes? The hard reality here is that if you wait until this actually happens to figure out your next steps, it's already too late. You need a mental playbook ready to go from day one. Okay, let's dive into this. Here is your roadmap for today. 1. The fading kitten threat. 2. Recognizing the emergency signs. 3. The stabilization protocol. 4. Daily weight monitoring. And 5. Hard stop vet red flags. Starting with Section 1, the fading kitten threat. To fight an enemy, you first really have to understand it. The phrase fading kitten syndrome might sound kind of vague, but clinically speaking, it's a very specific, rapid, and life-threatening decline. It's built almost entirely around a deadly triad: hypothermia, which means low body temperature, hypoglycemia, or low blood sugar, and dehydration. When these three interconnected conditions take hold, a kitten's health can plummet incredibly fast.
So why exactly does this happen so quickly? Well, because neonates are essentially fragile, tiny incubators that just can't run on their own yet. They have immature thermoregulation, meaning they literally cannot control their own body heat. Add in poor glucose reserves, extremely high fluid requirements, and virtually zero immunity, and you can easily see why a kitten might look just a little off and then crash hard within mere hours.
Moving on to Section 2, recognizing the emergency signs. Theory is important, sure, but out in the field, you've got to act like a medical dispatcher reading the physical clues of a crash. You have to use your hands and your eyes here. We are looking for a specific emergency cluster. Feel for cool ears, cold paws, or a cool belly. Watch their mouth. A weak suckle or a total failure to nurse is a massive red flag. Look out for sudden limpness, unexplained weakness, or tremors. Check their mouth again for tacky gums, which indicates severe dehydration, alongside sunken facial features. And of course, any level of unresponsiveness is an immediate emergency. You really need to memorize the stark contrast. A safe, healthy kitten is warm, pink, clean, and sleeping quietly with a nice, rounded, full belly. A crashing kitten, on the other hand, is the exact opposite. Cold, pale, lethargic, persistently crying, or worse, totally unresponsive. Which brings us to Section 3, the stabilization protocol. Honestly, memorizing this specific sequence is the absolute core of this explainer and your training. This triage sequence is brutally simple and absolutely critical. You must follow it in this exact order. Warmth first, then glucose, then hydration, and feeding always comes last. I literally cannot stress this enough. Warmth must absolutely come first before any other intervention, and you must rewarm them slowly. So the absolutely crucial point here is never feed a cold kitten. I'm going to say that one more time so it sticks with you forever. Never, ever feed a cold kitten. Let's explore exactly why that golden rule exists. If you rush formula into a cold gut, you are making a deadly mistake. A hypothermic kitten's gastrointestinal tract essentially shuts down. Feeding them can cause ileus, which is bowel stasis or obstruction. That routinely leads to regurgitation, which then leads directly to aspiration, where the fluid goes straight into their lungs. Warmth has to come before the bottle. Once they're warm, we move to step 2, glucose. If a kitten is hypoglycemic, you might see tremors or a collapse. You can apply a small amount of oral dextrose or Caro syrup directly to their gums. But heed this strict veterinary warning. Only do this if the kitten is conscious and swallowing safely. If they're unresponsive or seizing, applying oral fluids or syrups will just cause them to choke. Okay, Section 4, daily weight monitoring. Because managing an emergency is vital, but preventing one in the first place is even better. Your metric of life is a simple number 10. Healthy kittens need to gain about 10 grams per day to stay on track. To put that into perspective, that's roughly the weight of 2 US nickels. It sounds tiny, I know, but it isn't a suggestion. It's a strict physiological requirement for survival. What's truly staggering here is the sheer scale of the data behind this. Daily weighing is the simplest survival tool you have in your kit.
Large datasets from shelter medicine show that a failure to gain weight, or actual weight loss in those first few critical days, predicts a massive 13-fold increase in mortality risk. Tracking that tiny 10-gram gain is the most reliable way to catch an invisible decline before a crash even happens. Finally, Section 5, Hard Stop Vet Red Flags. There are times when home stabilization is just no longer a safe or viable option. Think of this as your escalation matrix. If you see pale mucous membranes and open mouth or labored breathing, that is an immediate vet transport. Repeated vomiting and profuse diarrhea, immediate vet transport. Severe crusting of the eyes and nose with respiratory effort, or marked lethargy where the kitten is entirely non-responsive, immediate vet transport. If a kitten is simply getting worse while you're trying to figure out what's wrong with it, you must abandon the wait-and-see approach. As the source material makes incredibly clear, when these specific red flags appear, that is not the moment for optimism. It is the moment for transport. We've covered the biological threats, the emergency signs, the strict stabilization sequence of warmth before food, the daily 10-gram metric, and the absolute red flags for vet care. You hold the playbook now. So I leave you with this final, vital question. Are you ready to be their lifeline?